Worldwide, cervical cancer is the third most common type of cancer in women, but it can be cured by removing or destroying the affected tissue so that a woman can still have children in the future. Dr. Frank Cirisano of Boca Raton Regional Hospital joins us this noon to tell us more on this, about how to prevent it, treat it, and some cutting-edge technologies. Good afternoon.
Thanks
for being here. Let's start with prevention, because as with most cancers, that really is the key, isn't it?
Correct. I think, the most effective early diagnosis measure has been regular Pap testing. The institution of regular Pap testing since the 1950s has resulted in an over 50% reduction in the diagnosis of cervical cancer alone in the U.S.
And surgery at this point, is it fair to say that that is still the most common treatment?
Generally, the treatment of choice is to remove the organ where the origin of malignancy occurs, and that would be a hysterectomy procedure.
Okay, but there's new and improved methods of doing that, right? That's making this a lot less cumbersome, a lot less grueling for women.
In the past, hysterectomy procedures had to be uniformly performed through a large incision, and that's associated with a higher blood loss and a higher infection rate. More recently, the initiation of the procedure through the belly button incision or through the robotic laparoscopy platform allows the procedure to be done in under an hour, and patients can often go home as an outpatient.
Wow. Now you brought some things. I want to make sure we get to these. You brought sort of some props for us to kind of show us what you just mentioned.
With the robotic platform, the incision needed is usually done through the belly button. And the size of this incision is approximately 8 millimeters, which is smaller than the size of a dime.
Wow.
That incision is made to accommodate an instrument controlled by the surgeon called the Robotic Laparoscopy instrument shown here.
Okay.
And this instrument is introduced through the belly button to allow the surgeon to perform the actual procedure. Using this incision allows the patient to essentially go home the same day or possibly the next morning.
And it used to be what, a week or more?
In general, patients usually stayed in the hospital 5 to 7 days.
Wow.
Additionally, when patients go home the same day, they may recover at home and be back to work within 1 to 2 weeks.
Okay, and now I want to show, I don't know if we can get a quick little close-up just so you can see. That's sort of a little clamp or a little scissor.
So this is a little scissor,
and we actually just, as you said, goes right through the belly button and does the work. It's amazing.
Does the work. It actually not only does the surgery, but also we can conduct electricity through this and use electrical cautery to control any bleeding.
Wow. Any final thoughts in terms of if a woman's watching us at home this afternoon who is facing this, any additional new tidbits that you'd want to get across?
Well, I think the most important thing is patient selection. The best patient candidates for this type of procedure are patients with early stage cervical cancers. And if the patient presents with an early stage cervical cancer, I think robotic laparoscopy is probably their best option.
Okay. All right. Well, thank you so much. I really learned a lot in this segment. I'm sure folks at home did as well. Thanks for coming in.
Thank you, Lauren.
And Boca Raton Regional Hospital does sponsor our expert and underwrites our Ask the Doctor feature.